Welcome to the Being Rare podcast, where we talk about navigating life with rare disease. I am Sarita Edwards, wife, mom, award winning advocate, nonprofit founder, and CEO, and your host. Sit back, relax, and enjoy the show. Hey guys, welcome to another episode of the Being Rare podcast. So today we are talking about Black Maternal Health. Black Maternal Health Week is April 11th through the 17th. This is an opportunity to raise awareness about the challenges and disparities faced by Black women during pregnancy and childbirth, as well as the overall impact on the community. April is also Child Abuse and Neglect Prevention Month. And this month serves as a critical reminder of the importance of supporting families, especially those caring for children with, complex diagnoses and special healthcare needs, which also include families like mine, families who are navigating a rare diagnosis. And so that's what we're going to talk about today, and we'll do it right after this. Edwards syndrome, commonly known as trisomy 18, is a rare chromosome abnormality. The Iwi Foundation is a 501c3 healthcare advocacy organization created to support families living with Edwards syndrome. The Iwi Foundation offers health literacy and community resources, comfort care, and financial support. Information at theewefoundation.org. So let's start the conversation with Black maternal health. So every year in the U.S., hundreds of people die during pregnancy or within the first year after giving birth. And Black women are 3 times more likely to die from a pregnancy-related cause than white women. And when we really look at the reasons behind that, a lot of that comes from challenges with quality health care. Some chronic conditions contribute to that, but we also have to embrace the reality that it also stems from systemic and structural racism and implicit bias from our healthcare space. We know that social determinants of health prevent a lot of people from um, Black and Brown communities from having fair opportunities to care. And so I think for this conversation, I really just wanted to raise awareness about the importance of educating ourselves about Black maternal health and how the healthcare system chooses to respond to the healthcare needs of Black and Brown women. It's easy to say, have a conversation with your provider if something doesn't feel right, but that's difficult when you are already not receiving the best care, right? And then it's easy to say stuff like, find another doctor. Well, for a lot of communities, that's just not something you can do. A lot of people can't commute to a healthcare provider further away than the doctor that's closest to their home. A lot of times I think the solutions that we give to people are unrealistic, and we have to figure out a way to make the healthcare system, the healthcare providers closest to them better at providing care. And when I think about Black maternal health, I am reminded about an experience that I had. I want to say it was back in 2010. Kareem and I, we learned that we were pregnant, and we started getting care. We had just moved, and my OB at the time was right at 2 hours away from where we had just moved to. And so I was commuting back and forth, trying to decide, did I want to just continue commuting, or did I want to find a doctor locally? So anyways, around 11 weeks or so, I started to bleed, and I ended up miscarrying. And I just remember being in a complete funk. Like I just was low, like depressed. And I think, looking back years later, I think I was experiencing postpartum depression that was just undiagnosed. And I remember after having the DNC, the procedure that you have after you miscarry, or the procedure that I had after I miscarried, I remember talking to my OB doctor, at my follow-up appointment, and I told him that I was feeling so low and that I wasn't feeling right, that I wasn't myself. And he said that because I made it to that appointment, that I was doing good. And to, you know, again, looking back on it, that was very, very dismissive. I don't necessarily feel like it was gaslighting. I mean, I think to some degree it was, given what gaslighting is, medical gaslighting. But I think overall he was just dismissive, thinking like you're not experiencing depression. And it's very, very interesting to me because I found myself thinking about just taking all of the pain medication that they gave me. Like, I literally remember having that thought. I could not get up out of the bed. I did not want to do anything. I wasn't cooking or doing laundry or anything like for my other kids, or like nothing. I was just confined to the bed. And I think in those moments, I think that's how we miss opportunities to provide better care, because he completely dismissed what I had communicated to him. He didn't tell me that I wasn't experiencing it. He said that I was okay. And so I walked away thinking I was okay. And it was after then that I had those thoughts. And so it becomes a what if, what if I had taken all those pills? And, like, I think we have to do better in missing opportunities to provide better care. And so that's my my Black maternal health experience specifically for me. And I'm glad that I came out of that, but so many moms don't. And so we have to do better. We have to do better. There are a lot of organizations talking about Black maternal health. It just is not happening enough. And so a lot of other groups are doing, great work when it comes to Black health, Black women's health. And if you know an organization that's doing some great work, make sure to drop it in the comments and leave that piece of information for someone who may be looking for it. And also for today's episode, I wanted to talk about child abuse and neglect prevention. So every year in the United States, at least 1 in 7 children experience some form of child abuse or neglect. And children with disabilities are at least 3 times more likely to be abused or neglected than their peers without disabilities. There's no single risk factor that tells us why a child um, might be abused or that a child will be abused. But children with disabilities and their families, they experience a lot of societal factors that may increase their risk. And so we wanted to talk about it. I wanted to tell you guys about the prevention initiative at the iwi Foundation, which is to raise awareness about child abuse and neglect and provide resources for parents and caregivers, and empower children with knowledge and skills to recognize and report abusive situations. The challenges for that with a lot of children with medical complexities or disabilities is they don't always know how to communicate, and they don't always recognize that they're being abused. And we believe that by focusing on education and community involvement, support, that we can help create safe and nurturing environments for children as they grow up. And a lot of that is really by providing education and resources and support to prevent child abuse and neglect. And so we want to talk to parents before they find themselves in that overwhelming spot. And we want to talk to others who interact with children with disabilities specifically, to help them, not find themselves in that spot as well, but also to recognize if a child with a disability is behaving differently somehow. And so we actually are working on a workshop specifically to child abuse and neglect prevention that will come out later this month. It's going to be available for folks to just watch, and continuing education credit is attached to it. You can just complete the assessment to get that, but But aside from that, it is available for you. All right, guys, that's all I have for today. I hope all is well in your world. Thank you so much for tuning in. Make sure to follow us on social media at Being Well Podcast. You can find me, Sarita Edwards, on all social media platforms. You can find live recordings of the Being Well Podcast on YouTube. You can also listen in wherever you stream your traditional audio podcast. Make sure to subscribe and follow. Make sure to turn on your notifications so you know when we've uploaded a new episode. Until the next one, be rare. Holla. Thank you for listening to today's episode. If you enjoyed today's conversation, please share it with others, post it on social media, or leave us a comment or review. Stay up to date on current conversations by subscribing to Being Rare wherever you listen to your podcast. Connect with us on social media at Sarita Edwards at the Being Rare Podcast. Until the next episode, be rare.